of us are too excited about going to the dentist, but if there's an emergency during the pandemic, what precautions should take place at the dentist's office? So we're going to join a dentist online, Dr. Wendy Barton of Dental Associates. She's joining us via Zoom, and she's going to give us an update. Good morning, Doc. How are you?
Good morning, Delia. I'm good, thank you. How are you?
A little concerned that all the dentists them is not happening. But tell me first of all, so most of the dental offices are closed. You say unless it's an emergency. What
Right. Some
qualifies?
are open. Some are open every day, but it's important that you call the various numbers that are available. You check the website, check Instagram, check Facebook for information. But we are available.
But what's being done now as best practice, Doc?
Well, basically, before anybody comes to us now, we need to do some pre-screening. We need to find out if you have any symptoms of COVID, fever, cough, shortness of breath, loss of smell, taste, recent diarrhea, headache, sore throat. We need to find out those things. We need to find out your age. We need to see if you're able to come in.
That sound like just wait. That's all. That's
No,
all I
because
got.
there are some things that cannot wait. There are some things that you need to come in because if you wait longer than 30 days, it could result in serious infection. It could even result in a hospitalization.
And I
So
think
there are things,
a lot of us don't put those Legos puzzle pieces together when you think about
right?
oral hygiene. So maybe a cleaning, not so much. But what are some of the things, Doc, that would classify as the emergencies that you say you would open up for?
Okay, so if you're in pain that you're unable to control with over-the-counter pain medication, if you have trauma, say for example, you fall and your tooth actually comes out of the socket, that is very important. You need to call us right away. You actually need to try and put the tooth in yourself because there's a limited time frame for that to happen for
Wait, Doc,
successful results.
Doc.
Mhm.
Me and Delia just look at each other. What you say a while ago? Doc, what you say a while
If the
ago?
tooth falls out, you need to hold it by the crown and put it back in.
Now she tells us.
Don't glue it. Just put it back in and try and keep it there until it gets
Rinse
in.
it for 10 seconds, hold it by the crown and put it in the socket. Give us a call. If you can't do that, put it in milk, put it in the corner of your mouth and head to the nearest dental office. But other things are if there is pus, if you're having difficulty swallowing, anything that's unusual, give us a call or message us and we will try to see you as best and as quickly as possible.
All right, so say all the teeth drop out and you really have to go.
All of them, Delia?
I sound so. what do you do? As the patient, what do I do on my part?
All right, so ensure that you're being completely honest because sometimes you might be saying, oh, my throat feel a little bit sore, but I don't have COVID, let me go in. Be honest. If you have anything like that, think about it. Try to protect yourself, try to protect us and your families by staying home. Similarly, the dentists need to do the same thing. Every morning when we go into the office, we need to get our temperatures checked. When our patients arrive, we're going to be testing their temperature. We're going to be asking them to hand sanitize. And we're going to be asking those questions again to make sure that everything is okay before allowing you to come inside.
But there's a risk, though, Doc, because some patients may not be presenting with symptoms.
Right, because you have those asymptomatic patients. So right now, we have to be thinking that anybody could have COVID. So basically, as you enter and we check you, we will be we will have on our mask. We will, yes, just as you see right there, we'll be having on our gear to check to make sure that there is nothing going on. And we're going to basically, when you get in, we're going to have on our mask, our face shield, eyewear, head covering, gowns, everything so that we protect ourselves as well. And we're going to be asking you to be sitting 6 feet apart in the waiting area. We're going to be asking you to come on time for your appointment. So if we see that our waiting room is crowded, we may have to give you a phone call or text message and say, wait in the car a bit. So, we're running behind time. We just want to clear our waiting room a little bit before you come inside. There will be no magazines anymore in the waiting area because we're reducing things that you can't touch. If you have a phone call, you may need to step outside to make that call because we're limiting conversations in the waiting areas.
And folks who come in have to be masked, correct?
As soon as as you come out of your car, you should have on your mask, as you know. But yes, we need you to have on mask. If for some reason you don't, we have to provide one for you. Because the only time your mask should be off is when you're receiving treatment. As soon as treatment is finished, you need to put the mask back on.
Yeah. These are guidelines by the Ministry of Health, by the way. So it's not that the dentists are allowed to add any little leeway to it. Do you have any idea or any indication when some of these might be a little bit more relaxed so more people can come and access?
Well, the thing is, we have to exercise our professional and clinical judgment because, say, for example, somebody has a broken tooth and there is decay. Will this decay result in the nerve being affected in 30 days? If that's the case, then we may have to do the filling. But we have to ensure that we're completely in our gear. We may even need to cover our shoes or have a change of shoes, a work shoe that stays at work. So we have to equip ourselves as if that person has COVID, if we have to do the filling, and we may just have to do the filling to save that tooth.
What about caps?
Well, right now, crowns are not so much an emergency right now, but that's case by case, and it depends on what's going on with the person. So that's one of those things that the dentist will assess and decide.
I see something about a consent form indicating that you have not experienced any of the known COVID-19 symptoms before you receive treatment. What if that's proven on the other side to not have been so? Is there liability?
Well, that is still in the air. There's still discussions. We're not sure what's happening with that yet, but we just need you to cooperate and sign the consent form, and then we see what happens following that.
All right.
Okay.
Thank you so much, ma'am, for being in for us this morning. Dr.
Thank
Wendy,
you for having me.
Good to have you, Doc.
Dr. Wendy Barton, dentist at Dental Associates. So please, guys, make note of all the things when it comes to visiting your dentist. Ministry of Health has given them guidelines and they can't break them. So we have to make sure that we follow them.
Yes, ma'am. All the best to you, Doc, and stay safe. After the break, a fun stop with an oldie, but goodie. We'll be right back.
Goodie.
Good as. It's me and you, them talking.